pleasure to be here with you today as I speak to you a little bit more about the Global Cancer Financing Platform, which we've heard a little bit about, but I will go into a little bit more detail with you. First, I want to just give a few things. This work would not be possible, as we've already heard about the importance of partnerships and collaborations, but this work up to this date would not be possible without some of those in this room, including ASCO. So Julie, thank you. The T.H. Chan Public School of Health at Harvard, Tim, thank you. And of course, the Global Health Catalyst, for which we would all not be here without it, so thank you, Will. So I know I'm going to be preaching to the choir here, but of course, we have a global cancer crisis. At the moment, we have over 70 countries in which cancer is now the leading cause of premature death. That is a staggering number if you consider that. And it becomes even more clear when you think that less than 5% of all global health funding actually reaches cancer care in low and middle income countries. That disparity is enormous, and that is exactly why we are pushing this work forward. Why this is important as well is because around 70% of late stage diagnoses occur in low and middle income country settings. And we know that the earlier you're able to catch cancer, the better your health outcomes are. In fact, over 80% of a survival rate for many cancers when cancer is found early. So we know that we have a crisis and we need to do something about it. Because as we also all know, geography actually is our destiny. Your chance of surviving cancer really depends more on your zip code than your actual biology. So what can we do about this? Well, there's one thing we can do, the financing piece. I believe this is truly the key to solving many of these issues and closing this equity gap. And we can look at the example of the Global Fund, which has contributed significant amount of funding for HIV, TB, and malaria, and has become one of the most impactful global health initiatives ever to exist. In fact, since their inception in 2002, they have averted over 63% of deaths when it comes to HIV, TB, and malaria. And that equates to a total of 70 million lives saved. That's enormous. And that's all because it has a dedicated financing mechanism being able to fund the treatments that are required. So what are we doing? Okay, this is the mission. The mission is to mobilize $1 billion by 2030, specifically for cancer care in low and middle income countries. But let me take that a step further. At least $1 billion by 2030, right? Well, I know you're all sitting there going, no. And let me take that a step further. At least $1 billion every year by 2030. It's gonna happen. It's gonna happen. But the question and the pushback we get is, well, how are you gonna do that when we're living in this global funding environment that has radically changed? When we look at how much the US this year has contributed to the total funding for development assistance for health specifically, it has dropped by $10 billion this year alone in 2025. So compared to 2024, last year of just over 14 billion, we're now at a total of 4 for the United States, contributing to global health funding. And as you can see, that radically impacts the total amount of global health funding in general. But that's okay, because we have a strategy. And the strategy is to build a finance engine for the future. So we don't disregard the things that are important and that work already for some of these big global funds. For example, philanthropy, the governments, development banks, these are all core pieces to the foundation of this funding. We don't disregard them, but what we do is we build above them. And so that includes looking at really innovative financing mechanisms that could tap into money that hasn't necessarily been used for global health in this way before. So diaspora remittances, we've heard about this, and we will hear a little bit more. Dormant assets, blended finance, and of course what we're hearing about today, public-private partnerships. And to wrap all of this together, radical transparency. We build a system that is transparent to provide a tool that builds trust. Because that's what transparency does, it builds trust. And I think we all know that that is the one thing that we can work towards together, is that trust aspect. So I'm just gonna give a brief example of that one kind of innovative mechanism, which we will hear more about again through Chris. And that is really, I believe, could be transformative, and that is the remittances. So Chris mentioned last year, it feels like last year. That last night, that Africa receives alone $100 billion in remittances every year. That's a total number that happens every year, this catalytic funding flow of money. Total combined remittances around the world exceeded $660 billion. So if you consider not just Africa, the 100 billion, but around the world, you can see how by unlocking that potential funding stream can be absolutely transformative. And it actually leads us to our goal of at least $1 billion a year. If we capture 1% of that, there we go, we've already done it. So let's get to it. I want to talk for a moment on how we have gotten to this point where we are all here today. This work started in earnest about a year ago, almost a year ago, in October of last year at the White House. We brought a core group of individuals, many of you here in this room together, to start talking about what would a global cancer fund look like. So this work started almost a year ago. And what has really kind of driven a lot of this work is a couple of key defining principles. One is that this work cannot be duplicative. We know that there is so much amazing work already being done for global cancer care around the world. We did not want to step into this space being duplicative, but we also did not want to be competitive. So you can imagine that all the organizations doing this amazing work already requires funding, and we didn't want to become yet another entity entering into the space saying, hey, actually we're going to capture that funding and we're going to use it for our purposes. So that is why the idea of this innovative financing mechanisms built on top of that is so incredibly important. We also want to build on the infrastructure and the initiatives that already exist. If we think about the work that PEPFAR, for example, has done with HIV, AIDS, TB, and malaria, it's incredible. We have infrastructure that exists, so let's use it, let's build on it, and let's amplify this work. And we also needed to find a path forward that would deliver the most profound impact and save the most lives. And so we've spent a lot of time talking to stakeholders from around the world in this last 9 months or so. And what we have started to realize and build consensus around is stage shifting. Using the global cancer financing platform to really bolster stage shifting around the world. So that means catching cancers earlier. And I think this has been a common theme that we have heard time and time again over the last 2 days. Early detection often doubles or triples survival rates. That's huge. You're giving people back the opportunity to live to their full potential. We also know that treating stage 1 is 2 to 4 times cheaper than treating stage 4. There's obviously there's less demand for these costly late stage care. So what does that do? It releases the burden off of the healthcare system as a whole. It builds on the existing platforms that I just spoke about. It leverages PEPFAR, it leverages Gavi, it leverages the HIV maternal child healthcare infrastructure. And the biggest total lives saved though, so yes, stage shifting is important, but when we think about this work in totality and moving forward, what we really need to think about it is a package. So modeling has shown that millions of premature cancer deaths are preventable or treatable each year if you have prevention, if you have early detection, and if you connect the existing treatment pipelines to that work. So you need that treatment part as well. So this is not to say that we would disregard those other pieces. This is just to say that those pieces would be brought into the fold with the focus being stage shifting. And to begin, we're going to start with women's cancers, because we know that saving women saves families and saves communities. And we're going to start with cervical cancer and breast cancer. And when we think about the economic toll, and this is just to put an extra point on the money point, global economic loss is about $2.5 trillion annually when you include productivity losses. The ROI for this work is that every $1 invested in cancer prevention and control yields at least a $3 return in health and productivity gains. So it just makes sense. This is a very logical way forward. And the only thing that is stopping us is ourselves to say that we're going to do this work. And I think we are together collectively saying that we are coming to do this work. Our entry into the global space, into the global world, and linking arms with everybody, including other stakeholders, other sectors, and governments, will be this week on Thursday at the side event at the UN General Assembly. We are going to shift from this core coalition of organizations that have been driving this work to building an entire global movement around it. And we're going to have a few announcements, including the diaspora remittance with Uganda, but also revealing a declaration of support that countries are beginning to sign on to. That moves us from we believe this is necessary to the global community believes this is necessary and is requiring this. And currently we have over 100 confirmed participants, including many of you in this room, at the highest government levels as well. And so we're very excited to be bringing everybody together. I want to end just on what the core principles of this work include, because this is really probably the most important part of this work. The first is equity. Investments must reach communities in low and middle income countries most underserved by current cancer systems. Ownership. Solutions must align with national strategies, institutions, and health priorities of the countries that we work with. Sustainability. The fund must strengthen long-term capacity, not create parallel systems or one-off interventions. Integration. Cancer care must be embedded in primary health systems, digital health platforms, and universal health coverage efforts. And finally, impact. This financing fund should unlock co-investment, drive policy change, and create system-level shifts, not just fund projects. So what are the milestones coming next? This year, we're establishing the governance. We need to kind of publish this framework, and we also need to raise seed commitments between 50 and 100 million. So if anybody knows somebody really wealthy, let me know. Next year, we are going to co-design with a pilot number of countries to be able to start this work together. In 2027, we will aim to expand to additional countries, and in 2030, we will mobilize the $1 billion that we will, at least $1 billion that we will have raised at that point, and demonstrate measurable stage shift efforts at national scale. And so this is my call to action for you, that cancer does not wait, but neither are we. And so we invite you to be a part of this movement, to be a part of this effort, and to continue driving this work forward to save as many lives as possible. So thank you so much for your attention today, and I look forward to working with every single one of you in the next few months to years. So thank you very much.